So in this video, we are going to talk about thoracic outlet syndrome and the special test for the thoracic outlet syndrome. So we'll start with the Roos test first, or in other words, EAST, elevated arm stress test. So in this test, the patient stands and abduct the arms to 90 degrees, laterally rotates the shoulder, and flexes the elbow to 90 degrees so that the elbows are slightly behind the front plane or the frontal line. And then the patient opens and closes the hand slowly for 3 minutes. If the patient is unable to keep the arms in a starting position for that 3 minutes, because and if the patient suffers from ischemic pain or heaviness in the arm or profound weakness in the upper extremity or numbness and tingling of the hand during that 3 minutes, the test is considered positive for thoracic outlet syndrome on the affected side. Keep in mind that minor fatigue or uneasiness in the arm is considered the negative test, but then the test is sometimes called the AER, like abduction and external rotation position test, or in other words, hands up test, or in other words, elevated arm stress test. The other test is a modification of the Roos test or the EAST test. In this test, the patient elevates both the arms above the horizontal and is asked to rapidly open and close the hands for 15 times. If fatigue, cramping, or tingling occurs during the test is positive for vascular insufficiency due to the thoracic outlet syndrome. The third test is the shoulder girdle passive elevation. In that, the test is used only for the patient who already have the symptoms. In that, the patient sits and the examiner grasps the patient's arm from behind and passively elevates the shoulder girdle and take it into forward for full elevation. In other words, you can call it as a passive bilateral shoulder shrug, and that the position is held for 30 or more seconds. Arterial relief is evidenced by the blood is rushing so that the stronger pulse, skin color changes to more pink and increased hand temperature. Or venous relief is shown by decreased cyanosis or venous engorgement. Neurological signs goes from numbness to pins and needles or tingling, as well as sometimes ischemic pain if the nerve is released. This is referred to as release phenomena. But when the shoulder is taking into elevation, the thoracic outlet syndrome symptoms are coming as a positive test. Now, the fourth test is right test or the maneuver. So, right advocated hyperabducting the arm so that the hand is brought over the head with the elbows and arm in coronal plane with the shoulder laterally rotated. He advocated doing the test in sitting and then in the supine position. Having the patient deep breath, rotating or extending the head or neck may have an additional effect. The pulse is palpated as for differences. The test is used to detect compression in the costoclavicular space and is similar to costoclavicular syndrome test. Examiners have modified this test over a time so that the description is as follows. In that, the modification of the test, the patient's elbow are 90-degree flexed while the shoulder is extended horizontally and rotated laterally. The patient then rotates the head away from the test side and the examiner palpates the radial pulse, which becomes absent or disappearance. The head is rotated away from the test side. When the patient rotates the head, the pulse disappears. Then the test is done in this fashion is called as a Allen's maneuver. The pulse disappearance indicates a positive test for thoracic outlet syndrome. Thank you.